Hello friends, welcome back to Complete Medical Coding. Today let's discuss few more guidelines and mock questions from CPT book, from the CPT code book. So let's discuss those practice questions. Before that, if you are new to the channel, please support me by subscribing to my channel. Let's move to the questions one by one. First question. Diana fell down on the ice and fractured her leg. The fall also caused severe injury to the muscles and tore several nerves. Her physician completed suturing of two major peripheral nerves in her leg without transposition and shortened the bone. After the surgery, she was seen by a physical therapist for ongoing treatment and gait training. How would you report the surgical procedure? So here we have to report, you have to code for the CPT code for the surgical procedure. Okay. The patient has fractured her leg. Anyway, let's look into the codes one by one. Open the CPT code book. Go to the first option, 64857. What is code 64857? 64857 means suture of major peripheral nerve, arm or leg except sciatic without transposition. Do we require that code? See, in our question, it is fracturing of the leg. The fall also caused injury to muscles and tore several nerves. What is the procedure done here? The physician completed suturing of two major peripheral nerves in her leg without transposition. That is one procedure. And shortened the bone. That is another procedure. So, without transposition, yes, we require this code, right? As mentioned in the question. See, two major peripheral nerves has been sutured in her leg without transposition. So we need this code 64857. Suture of major peripheral nerve, arm or leg without transposition. Now, what is the next CPT? 64859. 859 is suture of each additional major peripheral nerve. List separately in addition to code for primary procedure. Actually, for the code 64857, that is, what is exact description? Suture of major peripheral nerve. It's not nerves, it is nerve. So, it means it is for that code we will use for one nerve. Here, two major peripheral nerves has been sutured in the question. So, for each additional suturing, for each additional nerve suturing, you have to code for 64859. That is what the description for 64859. Suture of each additional major nerve, peripheral nerve. Since in our question it is two peripheral nerves, you have to code both 64857 and 64859. Okay, so these both codes are required. And see, there they have been marked with modifier 51. What is 51? Multiple procedure. Now, what is 64876? 64876. 64876 represents suture of nerve requiring shortening of bone. Yeah, that is what our next procedure is, shortening the bone, right? Requiring the shortening of bone of extremity. List separately in addition to the code for nerve suture. So that code also we require 64876 for the shortening of the bone. So we already got the three correct CPT codes. I'm not telling that A is the correct answer. I'm just telling you that these are the three codes which is required as per the question, right? The suturing of two peripheral nerves. The first peripheral nerve code is 64857. The description of the code represents only suturing of one peripheral nerve. That's why, since in our question it is suturing of two peripheral nerves, you have to put the add-on code 64859 for the additional peripheral nerve suture. Okay, and then 64876 code is for the shortening of the bone. Shorten the bone. Okay, for that procedure. Now, if you can see, option A and C are almost same except the modifiers. The codes are same. Actually, these three codes we require, but in option A, they have marked the modifier 51, which represents multiple procedure. Is this question, is the service a multiple procedure, do you think? No, right? Because it is in the same procedure, same surgery they are carrying out. Two peripheral nerve and shortening of the same nerve, the same bone, which is a single procedure, which is not a multiple procedure. So we don't have to append modifier 51 in this course. So the correct answer will be option C, which marks whatever 3 codes which we got. Okay, no need to mention 51 modifier because this is not a multiple procedure. This everything, all this procedure has been carried out in a single surgery, in a single procedure. So this is not a multiple procedure, so no need to append modifier 51. So the correct answer will be option C, 64857, 64859 and 64876. Okay. Now moving to the second question. A 32-year-old male presents with a deviated nasal septum. The patient undergoes a nasal septum repair and submucous resection. Cartilage from the bony septum was detached and the nasal septum was realigned and removed in a piecemeal fashion. Therefore, 40 chronic was used to approximate mucous membranes. Submucous resection of the turbinates was handled in the usual fashion by removing the anterior third of the bony turbinate and lateral mucosa followed by bipolar cauterization. What procedure codes are reported here? So here the repair of nasal septum. That's a procedure done, right? Okay. Let's move to the CPT codes one by one. What is the first code? 30620. What is 30620? 30620 is septal or other intranasal dermatoplasty. Does not include obtaining graft. Dermatoplasty. This is not, we cannot say this as dermatoplasty. This is repair of the nasal septum. Septoplasty this should be. Okay, not dermatoplasty. So leave that option. Now what is the second one? 30520. 30520 is septoplasty. See, this is septoplasty or submucous resection with or without cartilage scoring, contouring or replacement with the graft. For submucous resection of turbinates, use 30140. See, in the bracket itself it is mentioned below the CPT code. For submucous resection of turbinates, you have to use the CPT code 30140. So here, septoplasty, which is the correct code that we already got, 30520. Along with that, if in the question, if submucous resection of turbinates is present, you have to use the code 30140 as mentioned in the bracket. So what is 30140? 30140 is submucous resection, inferior turbinate, partial or complete, any method. Okay, this is an additional procedure. So you have to append it with modifier 51. Since it's a separate procedure, multiple procedure, you have to append it with modifier 51. So we got the answer as option B, right? 30520 along with 30140 and modifier 51. See, within 2 minutes, in less than 2 minutes, you can find the answer for this question. Okay. Now let's move to the third question. Joe had a malignant lesion removed from his right arm, excised diameter of 4.6 cm. During the same visit, the dermatologist noticed a new growth on James' left arm. Dr. Tom took an incisional biopsy of the new lesion and sent it for pathology. The biopsy site required a simple closure. How would Dr. Tom report the biopsy procedure? So we have to code for the procedure carried out by Dr. Tom. What did Dr. Tom? See, during the same visit, initially the Joe had a malignant lesion which was removed on the right arm. That is initially, means before it was telling. And then during the same visit, another doctor, dermatologist, that is Dr. Tom, okay, noticed a new growth. So Dr. Tom has removed it from the left arm. So we have to code for that left arm procedure. Incisional biopsy of new lesion means incisional biopsy of that lesion for the from the left arm. That is what we need to code, and it's a simple closure. Okay. So first option is telling that biopsy is included in the primary procedure and not reported. No, it's not like that. What is the second code? 1106. Incisional biopsy of skin 1106 means incisional biopsy of skin. Example wedge, including simple closure when performed, single lesion. See, simple repair means simple closure is already included in the biopsy procedure, so you don't have to code it separately. So this is what the exact code is, 1106, incisional biopsy of skin, including simple closure for a single lesion. This is a single lesion, right, from the left arm. If you want, you can check the other code also. What is 11406? 11406 is excision benign lesion. No, this is incisional biopsy and this is not excision. So you can't use that procedure. Now, if you go to option D, 11106 is there along with 12001. What is 12001? Just take 12001. Simple repair of superficial wounds of scalp, neck, axilla, external genitalia, trunk, extremities, hands and foot. This is what I was telling you. Since simple repair is already included in the biopsy procedure, you don't have to code it separately. So you can't use the code 12001. And also in the CPT 1106, already in the description it is mentioned, including simple procedure, simple closure, simple repair. So no need to code separately. And you have to append it with the modifier 59, which represents distinct procedure and service. Okay. So the correct answer is option B, 1106 with modifier 59. Moving to the fourth question. A 4-year-old is getting 3 immunizations in the pediatrician's office. The first vaccination administered is the polio vaccine intramuscularly. The next one is the influenza live vaccine administered in the nose. And the last vaccination is a varicella live vaccine, okay, by subcutaneous route. What CPT codes are reported for the service? So this is the code that you need to code for vaccines. Vaccination, these are the vaccination codes. So which are the 3 immunizations? There are 3 immunizations given. The first is polio vaccine, IM intramuscularly. Next is influenza live orally, not orally, in the nose, okay. And the last one is varicella live subcutaneous. So let's check the codes one by one. What is the first code? 90713. 90713 is poliovirus vaccine. For coding vaccination, you have to always code the medicines first, the first 3 medicines, and then followed by the route of administration. Okay. So what is 90713? Poliovirus vaccine. Inactivated means IPV, inactivated poliovirus for subcutaneous or intramuscular use. Yes, poliovirus is, poliovirus vaccine is given either subcutaneous or intramuscular, it's mentioned. In our question, it is intramuscular. So you can use that code 90713. What is 90658? I'm talking about option A, okay. What is 90658? 90658. Where is it? 90658. Okay, 90658 is influenza virus vaccine trivalent split virus. In our question, influenza virus, it is live, not split virus. So you can't use that code. So go to option. Now let's find out the code for influenza vaccine. Okay, we got already the polio vaccine code as 90713. Now we are looking for influenza vaccine code. Since that is the wrong code, you can skip that and go to option B. What is 90656? 90656. Yes, influenza vaccine trivalent split virus. Again, this is mentioned split virus, which is incorrect. Now go to option C. What is 90660? 90660. Influenza virus vaccine trivalent live. Yes, this is what we need for intranasal use. Yes, here in the question, influenza virus live administered in the nose. That means intranasal. Okay, so we got the code for influenza vaccine as 90660. Okay. Now what is 90716? Now one more vaccine is left, which is varicella. So 90716. Check what is 90716. Yes, varicella virus vaccine live for subcutaneous. Again, you have to code live varicella subcutaneous. As in the question, it is subcutaneous route. So we got the code for varicella also 90716. So 3 medicine codes we got. Now you have to code for the route of admin. Okay, 90471, 472 and 474. Let's check what it is. 90471. 90471 is immunization administration. Includes percutaneous, intradermal, subcutaneous or intramuscular, one vaccine. So you can use this as for polio vaccine, admin code, one vaccine, right? So 90471. What is 90472? Each additional vaccine, it's an add-on code. So for each additional vaccine, you have to use 90472. Okay. And what is 90474? For kids, for pediatrics, you have to, like those below 18 years, you have to always use the code 90471 and starting 90471. And for adult, you have to use 90460 and 461. Okay. So you got the answer as option C. Now moving on to the fifth question. A pediatrician is asked to be in the room during the delivery of a baby at risk for complications. The pediatrician is in the room for 45 minutes. The baby is born and is completely healthy, not requiring the service of the pediatrician. What CPT codes are reported by the pediatrician? So here, since the presence of pediatrician was there, still after the birth, it was not required. So it means no service has been carried out by the pediatrician, right? But you have to code for the pediatrician service. What will you code? This was just a monitoring service, a standby service. So you have to code for the standby service. Okay. Let's find out what it is. So what is option A? The first code 99288. What is 99288? Physician, that is an emergency service code, right? Physician or other qualified healthcare professional direction of emergency medical systems. Emergency care, advanced life support. No, so that's not the correct code. What is 99360? 99360 is standby service, as I told you. Standby service requiring prolonged attendance each 30 minutes. Example, operative standby for frozen section for cesarean or high risk delivery and for monitoring EEG. Yes, this is high risk delivery. This is what we need. 99360 standby service each 30 minutes. Here it is 45 minutes. So each 30 minutes means, for example, if in the question it is 1 hour, like 60 minutes, then you have to code this service times 2 as given in option D. 99360 times 2. That you can code only for every 30 minutes. Means, for example, if the pediatrician is in the room for 60 minutes, then you can use that code, that option. Since here it's only 45 minutes, you can code only for the first 30 minutes. Okay, so 99360. Anyway, let's check what is 99252. Option C, 99252. What is 252? 99252 is inpatient consultation. This is not inpatient consultation. So as I told you, for the standby service, you have to use the code 99360 for the first 30 minutes. Since it is 45 minutes, less than an hour, code it only once. So answer is option B, 99360. So friends, hope you like the video. If you have any queries, please mark it in the comments. If you have any doubts or clarifications, always feel free to ask me in the comments. And I'll be get back to you as soon as possible. So friends, if you like the video, please like and share. If you are new to the channel, please subscribe to my channel. And let's come back with more and more questions in the upcoming sessions. Thank you so much and take care. Bye.